More than 100 million Americans are affected by knee pain. Gabrielle Reece, one of the greatest women beach volleyball players of all time, is one of them. She's also a successful model, actress, writer, sports announcer, as well as fitness expert. Gabby joins us today to raise awareness about options for pain management. And there's a reason for that, because you recently underwent surgery.
Yes, about 7 months ago, had a full knee replacement. And a lot of times people look at me and they think, oh, you're kind of young for that. A lot of athletes can tell you that repetitive trauma, which is a nice way of saying bouncing around a lot. I wore my knee out.
Which you did?
I did. So I had pain for about 14 years. And then finally, when I lost function, I went ahead and had my knee replaced. And it was difficult. You know, at that time, I even decided to try to go the opioid-free route. So it was a big undertaking.
And for those of you that don't know, we've talked about them a lot, but opioid pain relievers, they're narcotics. They're used to treat severe pain. They work by binding to receptors in the brain, and that can block the sensation or feeling of pain. Today, we're joined by orthopedic surgeon Dr. Scott Sigmund. When you talk to your patients about pain management, I'm curious, what are some of the things that you talk about?
My patients are really worried about this opioid crisis right now, and they want to undergo these elective surgeries to get themselves out of pain, but they're very nervous or worried that their pain won't be able to be controlled, or are they going to become addicted to these medications. Elective surgery in particular has become an inadvertent gateway to this crisis. As many as 1 out of 15 patients that undergo major elective surgery may become long-term addicted to the medication. And the reason I'm here specifically is to create an awareness that there are alternatives to these opioids.
Well, and I've talked a lot with our viewers that I use acupuncture for pain relief and have been doing that for probably the last year and a half or so. And there are other modalities.
Yeah, acupuncture is a great option. There's electrical stimulation, nutritional supplements as well. Plus, there's a lot of new medications that are available at the time of the surgery as well. There's new oral anti-inflammatory medications that you take by mouth, the intravenous ones that also go through that are non-opioids, as well as local anesthetics that can also be used at the time of the surgery.
Yeah, this is important. The other reason I went through this is deciding not to take the opioids is I have 3 daughters, I am married, but it was challenging, and there's just so many options right now.
Well, speaking of your husband, it's interesting because when I see pictures of your husband, Laird Hamilton, for those of you that don't know, and Dr. Andrew Ordon side by side.
Oh. Wow.
What do you think, huh?
I mean, I could have been vulnerable a few years back if I met the doc there, right? Look at that. Oh, look at the beefcake.
I'm curious because you're both athletes. Did Laird help during your recovery as well?
Yeah, and the ironic part of that is Laird actually had his hip done the same day. We did it this way for 2 reasons. One, I thought he's going to look at me. Typically, the knee's more difficult in recovery than the hip, and he's going to be thinking, wow, I'm doing really good. And then the other side of that is we sort of understood how the other person, what they were going through, but he was definitely a cheerleader.
Knee replacement surgery, people know this, it can help relieve pain and restore that function in a severely damaged knee joint. What happens is a surgeon cuts away the damaged bone and cartilage and replaces it with an artificial joint. Yeah. The goal, of course, being return of function, pain-free living. I want to ask you, because rehab's a big part of this.
Yeah.
What kinds of things did you do?
You're walking right away that afternoon. The doc can tell you they really encourage that. Then you're on a little bike trying to get range of motion. You're on a range of motion machine moving you. And then I'm biking and ice and heat and stretching and eating a certain way to keep inflammation and just supporting the healing process is really important. But for any person getting surgery, you've really got to stay diligent about your physical therapy because that's the other end of the story, not just getting the surgery.
And for people out there who are thinking about, maybe they have a knee replacement surgery that they're thinking about doing or even scheduled, what would you say to them?
Well, this is why I'm here really and partnering with this message. It's a campaign called Choices Matter, and you can go to planagainstpain.com. We should all be advocates of our own health and knowing, and I liken it really to like a birth plan. When women have a baby, they go, I want to do this and that and this. You can actually do that with surgeries. There's a lot of options to make the recovery easier and better and possibly avoid the opioids.
So I've actually also partnered with the initiative as well. We want to empower our patients. We want you to know that you have choices in your options. There are alternatives to opioids that are available. If you're not sure what questions to ask, go to planagainstpain.com. take a small survey, print out those questions, bring them into the doctor's office. Remember, it's not just you, it's your loved ones, it's your children that are having surgery, the elderly, your parents as well. Help them get through this surgical experience, minimizing pain, but not becoming a part of this opioid crisis.
I want to thank Dr. Sigmund for being here, and Gabby,
Thanks,
you as
Doc.
well. Thanks
Thank
for
you, Doc.
profiling your story. Best of luck moving forward.